Hello viewers, I'm Dr. Meera Ragavan. I'm consultant urogynecologist and robotic surgeon. I have been in this specialty for 17 years. I have my own clinic called Chennai Specialty Clinic in Besant Nagar, Chennai, and I'm a consultant with Apollo Group Hospitals, Chennai. Menopause is a physiological change in every woman's life which happens in a certain age. It is usually defined as the complete absence of periods for continuously 1 year time frame. So this is associated with various hormonal and physiological changes associated with some psychological impact as well. Menopause can happen at any age. However, the usual age of menopause in Indian women is around 48 to 52 years. This is determined genetically. For example, if your mom had menopause at the age of 42, it is more likely you would have menopause around the same time. Menopause, as I mentioned earlier, is the complete absence of periods. This happens because of ovarian failure. Ovaries are the organs which produce the main hormones, estrogen and progesterone. When there is a depletion or decrease of these hormones, because of declining function of the ovaries, there is an absence totally of the estrogen, which then creates menopause. Now, the symptoms are associated with depletion of such hormones. Majority of the women undergo what we call hot flushes or sweating. They suddenly feel very hot and suddenly feel very cold. They also have episodes of bursts of sweating, especially in the night time, disturbing their sleep pattern. They have early awakening of sleep and also have disturbed sleep. Usually women tend to gain weight because of water retention at that time, and that can persist, giving rise to various problems in the future. Menopause also causes depletion of the calcium stores and deposit in the bones, leading to what we call bone weakness or osteoporosis. Should the menopause occur at a very early stage, either due to other pathological causes or diseases or due to treatment, such profound bone loss can happen, giving rise to severe osteoporosis and osteoporosis related fractures in later life. Menopause also affects mental health significantly. This is the time when women are subjected to greater stress, leaving them with a lot of psychological disorders ranging from anxiety, depression, even up to significant psychosis. Menopause happens physiologically due to complete cessation or decline of ovarian function and thereby loss or decrease in the levels of estrogen and progesterone, which are the hormones secreted by the ovaries. This is a natural process. However, in certain women, this can happen earlier than the usual age because of genetic reasons, because of any chromosomal abnormalities, or due to diseases which affect especially autoimmune disorders which has antibodies produced against the ovary. In some women, it is iatrogenic as a result of treatment for other cancers. For example, breast cancer, when they are given chemotherapy or given radiation, this can result in a premature menopause. Premature menopause is defined as when the woman has cessation of periods even before the age of 36, which we now commonly see in various women because of changes in lifestyle and stress-related disorders. Menopause, as explained earlier, is a physiological change. Usually, the treatment is only supportive. One has to maintain their appropriate weight, ensure that there is no excess weight gain, maintain regular physical activity and exercises for at least 30 minutes to 45 minutes in a day, ensure they're taking calcium supplements or calcium rich foodstuffs like milk, ragi or certain green leafy vegetables. They also might need certain vitamin supplements. Adequate sleep has to be maintained, and ensuring that they are not developing any pre-warning signs of cancer such as of the breast or the uterus, and an annual regular checkup with the gynecologist is mandatory. In certain people, menopause can be stormy. The warning signs are usually infrequent, irregular periods. Should they have any change in the menstrual pattern, they should immediately approach the gynecologist for advice. But certain people will need hormone replacement therapy in the form of tablets, especially when the menopause is premature, less than 35 years. Menopause usually leaves us without major complications. However, if not managed adequately, menopause can lead to severe depletion of bone strength, resulting what we call osteopenia in a milder variety and osteoporosis in a severe variety. Osteoporosis mainly affects the neck of the long bone in the thigh, which is called femur, or in the vertebral column or the spine. Such bone depletion can lead on to osteoporotic fractures, resulting in the hunchback and decreased mobility of elderly women. Cholesterol levels have to be checked, and if deranged, can predispose the menopausal woman to the same risk of heart attacks as occurs in men as well. Menopause complications can be prevented by maintaining appropriate level of physical activity and exercise, and watching your diet, especially your carbohydrate intake. Reducing excessive weight or preventing excessive weight gain is a way to prevent various complications. Menopause, if not adequately supported, can lead on to deterioration of women's physical and mental health. If the depression or anxiety is not treated, it can lead to deterioration of the mental and physical well-being of these women. Adequate vitamin supplementation and calcium supplementation, if not taken care of, will lead to osteoporosis and fractures in these women. Maintaining general health, especially with regards to blood pressure, weight gain, blood sugars and cholesterol levels, is mandatory. Otherwise, these women are at the same high risk as that of men in developing coronary artery disease, fatal myocardial infarctions and strokes as well. Osteoporosis can lead to spine fractures and the thigh fractures, which can make these women immobile and thereby increasing the risk of death due to clots in veins and lungs. So menopause has to be adequately supported, properly treated, and the health of these women properly maintained. Thank you, viewers, for watching this channel on general awareness about women's health and menopause. Kindly subscribe to this channel and kindly spread the word by sharing this link so that many people are aware about this particular health concern. If you want to know more details, kindly WhatsApp on the number 9600020690 or email the Chennai Speciality Clinic @gmail.com. Thank you.